This is how we verify embryos for your frozen embryo transfer. Before we thaw everything, we make sure that the order is correct for each patient. This is just a test patient, but we verify her name, her patient ID, and her date of birth. The order is created by the physician, and it tells us exactly what embryo to thaw. We then cross-reference the patient's VIT sheet with their order. This ensures that we have the correct patient with the correct order as well as the correct embryo. The patient's name and cryo date is on the top of the cane. The straw that the embryo is frozen on also has all of the patient's identifying information. This information matches the information on the patient's VIT sheet as well as what is written on the patient order. Right before the thaw, the embryologist verifies the name and information on the straw and the information on the VIT sheet, and also has another person do the same thing. So there's a two-step verification, and then we are both initialing that we verified the name and identifiers. Once the embryo is thawed, we take the label off of the straw, place the label on the patient's paperwork, have the thaw embryologist initial and the person who verified initial. After your embryo is thawed, it is placed in a dish with your last name and medical record number. That dish is then placed in an incubator labeled with your last name. Before we do the timeout with the patient, your doctor, in this case, Dr. Copeland, will come into the lab and verify the label that we took off the straw, the patient order, and the patient VIT sheet. Once the physician has verified the order and the straw information, we are ready to do a timeout with the patient. We come in the FET room, we are verifying her wristband that has her identifying information, and we ask the patient to say that information out loud. So Amy, if you could give us your information.
Amy Jo Test, birthday January 10th, 1976.
Great, and what are you here for this morning, Amy?
Embryo transfer.
And how many are we transferring?
Just one.
Great. After the timeout with the patient, before we do the embryo transfer, the doctor then comes back into the lab to verify the dish. Dr. Copeland is here verifying the dish and making sure that it matches everything that Amy told us, as well as the sticker on the embryo straw. After your doctor has verified the dish and we are ready for transfer, I load up the embryo catheter with your embryo, walk into the transfer room, and as I walk in, the doctor, the patient, and the ultrasound tech are in there, and I say we have one embryo for Amy Test. Everyone verifies one more time, and then we do the transfer.